We screen right now for all these different cancers, but heart disease continues to be the #1 killer, the #1 cause of morbidity and mortality in the United States, more than all cancers combined, and yet we never screen for it. We never look in the arteries to see, do you have coronary artery disease? Do you have plaque buildup in the heart? The heart attack that happened at 60 starts at 40, you know? And so if you catch it early and you can just detect if you have plaque or you don't have plaque, you can really help risk stratify a patient. You can understand the trajectory of their disease. A company like Heartflow, honestly, is going to change the lives of millions of people around the globe.
Heart disease is a huge problem around the world, and you can't manage something, you can't treat something if you don't measure it.
Traditional non-invasive methods for coronary disease don't actually look at the coronary arteries. They look at other surrogate signs or symptoms of the disease.
A few years ago, we were doing coronary CT angiograms, just grayscale images with various densities defined by white or gray or black. But with the advent of Heartflow and artificial intelligence analysis of those CTA images, I now had precise categorization of softer plaque, vulnerable, low-intensity plaque, and I could watch that plaque change in density.
When you do coronary CT as a platform, we're going to shift away from those population-based strategies, which are probability risks.
So we create a precise 3D model of the patient's coronary arteries that looks way beyond anything they've seen before from a non-invasive test. You can see every coronary artery in detail.
AI and the ability to identify images and parse those out way more precisely than the human eye ever could. And that's what we do, and because of that, we can find that disease earlier, more precisely than any other alternative.
Implementing Heartflow has allowed us to make sure that we're doing the right test for the right patient. We're able to accurately diagnose and treat the disease, which makes our patients happier and also our clinicians.
You know, there's a saying, a picture's worth 1,000 words. And when you show a patient a picture of their heart with plaque buildup in it, it hits a different level of reality for them.
And what we know now is when a patient understands their coronary disease, they're much more likely to actually take steps to help manage it.
And it's a great opportunity for physicians to better engage with patients to ultimately prevent heart disease from progressing.
Heartflow's vision is to transform coronary disease from the leading cause of death to a disease that can be proactively managed for life.
And now we have this amazing technology that just lets us get so much better and more detailed information, and it really just, I think, gives a glimpse of what sort of things we have in store.
And really, there's no other technology that gives you that full spectrum of what to do, from choosing the right medications to choosing management strategies for invasive or non-invasive as well.
I think coronary CTA with a Heartflow analysis is the future of cardiology.
None of this happens without a team that works together well, is dedicated, puts the patient first in everything we do.
We are helping physicians see coronary artery disease and manage it for life.